After months of reduced COVID positivity rate, the risk of an upsurge is back with the cold season as well as respiratory diseases.
3 out of the 8 influenza surveillance sites, namely Kakuma, Kenyatta National Hospital, and Nakuru, are reporting an increase in the number of flu cases.
According to the Ministry of Health, Kenyans are not being adequately vaccinated against COVID-19. In the last 7 days, 2,868 Kenyans have been infected with COVID-19.
Most of the ones in hospitals are persons who have not been vaccinated.
The fear of strides achieved in mitigating the virus being reversed has prompted the Ministry of Health to remind Kenyans of what needs to be done to avoid a health crisis.
The mandatory wearing of face masks in open public spaces, where one is not in close proximity with another person, remains optional. However, one is required to wear a mask when in contact with other people in close confined spaces, such as PSVs, aircrafts.
However, indoor meetings as well as church services shall continue as usual, only that one shall be needed to have a mask on and both doses of the vaccine.
Unvaccinated travelers arriving at any point of entry will be subjected to a rapid antigen test at their own cost. Any person who tests positive to an antigen test is subjected to entry to a PCR test at their own further cost, and a self-isolate again, according to our guidelines, at their own further costs.
At the same time, counties are required to be vigilant in the event of an anticipated COVID-19 outbreak.
Revamp their isolation facilities and secure adequate supplies of PPEs, and particularly prepare with oxygen supplies.
As the country approaches the general election, the Health CS has further called on politicians to advise their supporters to observe social distance as they interact during rallies.
There is nothing that is more important than your life.
Ben Kerera, K24, Nairobi.